Hi, everyone. Thank you for joining us. We're about to get started here just shortly. Okay. Well, good afternoon, good morning, good evening, everyone, and welcome to our final session of the Patient Engagement Open Forum, the PEOF of this year. For the next 20 to 30 minutes, we'll look at our journey as the PEOF so far, give a little bit of an example of what we've achieved this year to support the growth of patient engagement and involvement, preview what's to come next year, and you'll also have the opportunity to shape our 2023 PEOF editions. My name is Elizabeth Priest. I'm a program director for Patient-Focused Medicines Development, PFMD. I'm speaking on behalf of the PEOF organizers, PFMD, UPADI, and European Patients Forum, EPF. I'm honored to be joined here today by Robert Joyce and Dr. Stuart Faulkner, who I will now ask to introduce themselves. Robert, starting with you, could you please introduce yourself?
So I am a tremendous advocate of including more patients in research, and I do this in several different ways. I have a blog that I have about my life living with multiple sclerosis and chronic pain called A 30-Minute Life. But I'm also involved with PPI Ignite in Ireland, which is an amalgamation of all the universities in Ireland, their program for including more patients in research. And I also work with the Health Service Executive, which is the Irish health system, on how they can include patients in their new program for research within the health service.
Thanks. And yeah, hi, everyone. My name's Stuart Faulkner. I'm a researcher at the University of Oxford in the UK. And I've really been involved since the beginning, since the inception of the Open Forum here. So I'm really excited to see how it's evolved and continue to be involved and really try to drive it forward as we look to grow bigger and better. So welcome.
Thank you both so much for joining us today and speaking to your ambitions and your experience also with the PEOF. So let's get into it. First things first, we'd like to start by thanking you all, our contributors here in the audience, for your continuous support in the journey that PEOF has had so far. So hopefully if you're joining us today, then you've already attended a session either as part of these November editions or previously so far this year. But our audience is really what makes us different. 2022 marked the 5th year of the PEOF and the 2nd year of going beyond paradigm. We've had over 4,000 attendees supporting us along the way. And we've really been able to reach an audience of 1.5 million people, holding over 22 co-creation sessions this year alone. So really working towards our goal as the Patient Engagement Open Forum, as the PEOF, of breaking down barriers and defragmenting the PE landscape. One of our key characteristics of PEOF is that we actually ask you to do the work. So we ask you to come, roll up your sleeves, and help us shape ongoing patient engagement initiatives in real time. So if you've been a part of a session over the last 2 days, you've seen us use group maps, Slido, poll questions, everything we possibly can, using the chat, the question and answer, to really get the input of our audience and improve these ongoing initiatives. So on the screen here are some of our themes that you have directly contributed to over the last 2 years. We'd like to show you kind of practically what that has looked like by zooming in on one specific ongoing project in patient engagement. So we're going to use this real life example of PEOF contribution through the PFMD Patient Remuneration and Fair Market Value Project. While PEOF has served many projects, this one shown here is one example. It's a project led by a multi-stakeholder working group but along the way, they've needed the support and input from the patient engagement community at PEOF. So practically, this has looked like the PEOF helping launch a public consultation at a PEOF session in October 2021, getting input on needs and knowledge gap throughout touch points throughout 2022, and even using the PEOF to help operationalize and test these frameworks in April and October. All of this has been invaluable in developing the frameworks and also leading to a fair remuneration digital tool coming in 2023. So you can see it's even a broader touch point in this co-creation process where these ongoing projects really need value and incorporate the feedback that we're all providing and working towards here at the Patient Engagement Open Forum. So this really is just one example of how we can use the PEOF to shape projects, initiatives, and topics in patient engagement and involvement. So now I want to briefly introduce a way that you can share your input with us for 2023. So if you go to the next slide. Ahead of this session, we've emailed out a group map link, which we will also share now in the chat. It is our usual collaboration tool. We love it because it doesn't limit what you say and how you say it. You can type in whatever you want. Please use it to provide your suggestions on the themes that are there, as well as add information about organizations, people, initiatives, other things that we're missing that you would like to see brought to the Patient Engagement Open Forum in 2023. So this involves both virtual editions, in-person editions. Please feel free to use that blank text box to tell us anything that you'd like to see in PEOF for 2023. And this is not limited to PFMD, UPOTI, or EPF. This is actually an opportunity and a forum for the PEOF to be used by others as well to bring their ongoing initiatives to PEOF in 2023. So we'll come back to this later so we can see some of those results and some of what's going in our group map. For right now, I'm actually going to give the word to Stuart, who has really been a close partner to PEOF through Paradigm and also as a member of our PEOF program committee, to speak a little bit to one of our big achievements this year. Stuart, over to you.
Yeah, thanks, Elizabeth. And I think you've hit that upon. I think 2022 really was, an exciting year, not only for the PEOF here, but it was this achievement of finally, after 3 years, managing to actually see real people in the same room and collaborate that way. And we were able to do that with 129 participants. We met in October. And you can see the pie chart on the screen there. We had an excellent representation from the patient community, but also from other stakeholders like the research and academia and industry as well. And I think what really struck me was the need for the physical bit of engagement, in patient engagement, that real longing for the physical connectivity, the relational building that we've really missed over the last few years, and really that is key for solving some of these challenges that we're trying to solve together as part of this community. And also, I think it was a good point to just reflect that over the last 3 years, I think we've learned quite a lot about what works well when we do things remotely and when we try to co-create remotely and via these hybrid sessions. We've learned quite well what types of projects, what types of activities are better suited to some of these modes of interactions, but then also acknowledging, I think, that there's other types of activities where co-creation does need to be face-to-face. It is messy, it is chaotic. You do need to sit across the other people in the room and look them in the eye to truly understand where they're coming on. So I think one of the things moving forward is really how can we fine-tune that balance between these remote and hybrid events that have been excellent, and everyone gets a gold star for coming to these because you've really been exceptional as a community. But how can we find that fine balance moving forward between the right mode of interaction, whether it's remote and hybrid, versus the bits that the best, these messy, chaotic bits that need to be done face to face, and how can we maximize the value from that? I think in terms of the sessions that were run at this face to face, there were a huge mix of sessions. I can't really do that justice by going into every session, but there were a few sort of key topics and key messages that kept coming up again and again. And I'll invite Robert in a minute just to add his thoughts here. But I think one thing that I heard a lot of was around the language that we use around patient engagement when we talk about patient engagement itself, but all the complexity and the jargon we use around patient preferences and patient data and what that actually means. And essentially we are all talking about the same thing. We're all trying to move in the same direction, but we don't often use the same words, and that creates a problem. That creates blocks, that slows things down. So I think really this is a call for us as a community, and things that we should be thinking about in PEOF about how we can really align much better on sort of universal language for patient engagement. I'm not talking about necessarily agreeing on definitions, but just being clear what definitions we are using and what context we are using those definitions in. And I think that would all give us an immediate uplift in terms of our ability to communicate effectively and meaningfully, and really opens up some of those opportunities to bring new members into the community that we have here. And actually that issue of language actually came up a lot in the previous session we've just had with the DIA Europe as well. So clearly that's a hot topic that we need to think about. I think the second topic, I think related to that, was it's quite difficult when you're in a multi-stakeholder environment to actually communicate effectively. Particularly people coming into a multi-stakeholder environment, into that community. If this is something you're not used to, it actually can be quite daunting. That's what I heard. It's quite daunting. It's an unfamiliar environment. So actually, how can we better support new community members, wherever they're from, but particularly patients? How can we better support them so they can feel integrated, they can know how to engage and communicate it effectively, they can know to speak up, they can use the right language. And also through what perspective, when we ask them for their input, through what perspective are they giving it? Is it their stakeholder perspective, or is it their individual perspective? So I think there's more we can do to support bringing new members into our community and really making them feel welcome and that their voice is heard. And then I think the third topic, we had some discussions about who wasn't in the room, or wasn't yet in the room, and perhaps who could be or should be. And of course, I come from an academic community, and I say that's probably one of the stakeholders who I think we could do more. We could have more academic researchers, whether that's clinical researchers, basic researchers, but also funders, to really get them into the room, get them excited. And I have to admit, from my own stakeholders' perspective, I think we could do better. The opportunities that we have to engage are sometimes limited. Our value proposition to our own members are also quite limited, and we could be better with that. So I think that's something for me to take back to my community and really try and improve that. Robert, do you have anything else to add? Do you hear any other things, burning topics?
Well, one of the things that really impressed me about attending the event in Barcelona, the PEOF event, was the degree of collaboration between everybody. And it didn't matter whether you came from the research, patient, or industry sector, everybody was working together. And it was those conversations, and I remember having one with you even, Stuart, after one of the sessions. We really got in depth into the issues that are there for more inclusion of patients within the research process. So I think for me, it was a fantastic experience being there, because I got to meet people who I'd only ever met virtually, first of all. And there is, as you said in what you were saying, Stuart, there is a big difference between the virtual world and the in-person world. And you develop a connection that is, I think, stronger. You get a better understanding of the motives and the desires that people have in how to include patients more in research. the one other thing that I really loved about it was the balance, that there are 40% of patients involved in these sessions. And that just shows that we are equal stakeholders, I think, in the process. So that to me was really encouraging. And I know in those conversations that I had in the restaurant, for example, about how we can include us a little bit more, or where we can get funding for patients to actually start deciding on what we should be researching. It's such a simple thing, but I was sitting next to somebody at a table and I was told, this is where you need to go and this is what you need to do. And isn't that such a tremendous opportunity that would never have happened for me if I wasn't at such an event? I also trained in UPATI with a number of people who attended the event, and to meet them and get to share a little bit more about why we were at the event, but also what our hopes are for the future and how we can collaborate together to actually help each other as patients be more effective within this collaborative environment.
I think it's so nice to hear you guys talk about ways that we can do more and bring more to this as well. And I love what you said, Stuart, about who wasn't in the room yet, because I think that is the important part, so we can continue to enable these conversations. Robert, I hope that what you've said here even related to having and enabling that conversation around what to fund in research, for example, is one of the topics that shows up on the group map. So I hope that we've already gone and inspired our attendees here today to give us some good input about what we can continue to do to improve this in-person event and our virtual events next year, which maybe is a good transition to, Robert, you have the pleasure of announcing some of what our audience can look forward to next year.
So there will be more sessions. And, you know, based on my attendance, even at the precision medicine event there 2 days ago, it is very collaborative, and there are going to be more of those. But I think what we need to do is we need, as a community, to talk about what we want to learn more of, what we need to hear what the people are thinking of different topics. And even going to what Stuart was saying there earlier about who is missing in the room, one of the groups that I think is still missing are the clinicians, the people who are actually delivering the therapy to us as patients, because they are part of that triangle between research, the patient, and the clinician. And if those three groups are properly represented within this, I think the research that will derive from this is going to be more focused, and it will actually be more targeted on improving the quality of life of patients. And that's ultimately why we're all doing this, so that my life as a patient is superior than it was without doing this patient engagement. And I think that's where the great opportunity is. Also, we will be having another live event, and it would be lovely if we were able to announce where that is going to be at this session. Unfortunately, we can't, but soon. But I am really looking forward to getting to meet not only some people that I've already met before, but some new people that are coming from these different stakeholders. And I even think things like what Stuart was saying, the funders. I think it's really important for the funders to see what are the needs of the patient groups and what we should be looking at. And maybe funding will be geared not necessarily always towards the medicine, but to the therapies or even the structure of the health systems, so that they're more adaptable to the needs of the patient. And then spreading the message. And I know for me that I have been involved with several things here in Ireland where I have shared my experience of being involved with PEOF and UPATI and all the various groups that are involved here. And even, and I've been involved in a trial myself, a feasibility study And I am trying to assess the value of including patients within that study. And that is one of the things that I have been able, through the sessions that we already had with PEOF, know better how to write that paper. But also, I think we need to do more about that, deciding what are the metrics that we should be looking at into the future that will not only improve the patient quality of life, but will be the things that governments and the payers are going, what kind of information do they need to show the benefit of having patients included in research throughout the process. One other little dream that I have for the future is, and this goes back to what Stuart is I think we need to have more patients involved in education of healthcare professionals throughout their education process. And if that is done, I think it will be a way of normalizing the inclusion of patients throughout the process. And then when research happens, it will be obvious to include the patient because of the value that those patients have given to those healthcare professionals as they're being trained. Stuart, do you have any thoughts?
I think they're fascinating insights there, and I heartily agree. There's some key people missing here. The clinicians, the educators, and us as a research community. I think bilaterally we have a lot more to offer, and we need to be better. I think we need to be better at working together, and we need to find ways to work together beyond just publishing a paper. There are other much bigger collaborative potentials and knowledge learning there that we can use. But actually, just picking off your point, Robert, I think that the question as to who was not in the room or who was not yet in the room, I think I can take that to the next layer and say, well, it's not just which stakeholders are missing, but which geographies are missing from the room. And I think thinking about where we might expand next year and beyond that, I think we have some really key opportunities to try and include some new geographies in our community here that have not yet had an opportunity to be involved. But also we have to remember that we're building a knowledge community, and knowledge has currency. And with that currency, we can do an awful lot. So moving forward, could we think about perhaps extending into, for example, Central and Eastern Europe regions as one example? Could we even think about South America as another example? They're just two examples of potential ways that we can expand that community. And I think in doing so, my only caution there is I think we have to do that both flexibly and sustainably as well. I think there's sort of three principles to follow here. Whenever we think about including new geographies, I think we have to listen to the local stakeholders first, be very clear that we understand the context of what we're trying to do, and leverage those local contexts, the community, their ways of working, their ways of communicating. So back to the language around patient engagement, cultural competencies, and also making sure that bringing both people in and in terms of our outputs going outwards, that they are adaptable to the local context. And I think that way we can really build that community in a sustainable way. Where we go and what geographies we reach next, I think is really up to the community we have here on the call. And I guess that's a good segue to back to Elizabeth to tie us up on that.
Yeah, that's such a great point. Thank you, Robert. Thank you, Stuart. I think we have this opportunity now to continue to spread our message through the support and together as a community. And we have this platform that is PEOF. And I hope that we can start thinking about it as our platform, right? It's not PFMD or UPADI's platform, but or EPF's platform, but it's all of our platform. And one of the ways that we can continue to get those stakeholders in the room that aren't in the room yet is to use PEOF to engage with new audiences through new collaborations. I think what we've done this week even has been really great to see, whether that's our first session in Japanese, completely in Japanese for a Japanese audience, co-creating patient engagement tools together and adapting them for the Japanese context. Or even we had the session just now, as you mentioned, Stuart, with DIA, and that's such a great collaboration as well, leveraging both audiences, the expertise that comes from bringing more people, more diverse points of view into the room, and using PEOF as that platform in order to continue to grow meaningful patient engagement, which is essentially why we're all here. And love the idea also of us thinking about how PEOF can be used to do more as far as setting that common language and be a place where we enable and provide a forum to have that conversation. So just a few things that you were making me think of as we go. We just have a few minutes left. I'm just gonna, maybe we can reshare the group map link in the chat. We will also email this out. We will keep the group map open. It is organized right now in themes. So themes that have been kind of central to the patient engagement open forum so far. But there's also a column there that says, what else? What else do you want to see? So please go in there, add your ideas, tell us what you are looking forward to. As Stuart mentioned, help us decide where to go next. And together, I think we can continue to grow the patient engagement open forum next year and for many years to come. This is truly just the beginning. So if we go to the next slide, this will round us out. Please, we hope you enjoyed being a part of the PEOF community this year. We hope to see you again next year to continue to help us shape the agenda for 2023 and for years to come. Thank you, Robert. Thank you, Stuart. Any last words that you'd like to add in?
The future is uncertain, but I'm excited. It excites me. So I can't wait to find out what's happening next.
I'm just like you, Stuart. I am waiting, and I think that given the passion and the emotion actually that was there at the last event, and even listening to the speakers, like when I was listening to the precision medicine thing there 2 days ago, there is this tremendous desire to really include patients more effectively in research, and I think we have a huge opportunity for really improving our society by being more inclusive. And I think we are just one of the elements in our society that we are doing our best to be more inclusive. And I think we can be an example to other sectors of society of what can happen when you're really inclusive.
Thank you, Robert. Thank you, Stuart. Thank you to the audience for joining us for this quick touch point to round out the year. And a big thank you to our sponsors as well, who not only enable the Patient Engagement Open Forum, but all of the fantastic work and milestones and collaboration that has come to the ongoing projects along the way. Thank you all so much. Have a wonderful day, wonderful evening, and we look forward to seeing you again in the new year.